I am really thankful to have made a complete recovery from Ebola. I don't have any lingering health problems. The outbreak is over. There are no more active cases of people with Ebola virus disease in West Africa. The impact of that outbreak on West Africa will be very long-lasting, and communities are rebuilding, and people who had Ebola are struggling to rebuild their lives. They face not only the health problems that they might have, but also the social consequences and the stigma that is placed against them. They've been kicked out of their homes and their communities. They have to hide their identity from people, not let people know that they had Ebola. In a very stark contrast to that, I often get treated like a celebrity, especially when I come to places like Oklahoma Christian University, where so many people know me because they prayed for me and their churches prayed for me. That's the response I get most often. If someone recognizes me, it's, I prayed for you. And that's really, I will never get tired of telling people thank you for praying for me. There are a lot of Ebola survivors who do have serious, significant health problems, and Ebola survivor care in Liberia and in West Africa needs a lot of support. And the healthcare systems there have seen a huge setback in terms of the quality of care and the level of illness with which people present to healthcare facilities, because for so long people were afraid to seek healthcare. And so now, especially like my friend Rick Sacra is championing the HIV treatment program at ELWA Hospital, and he said they're seeing people come into the hospital with advanced HIV like they haven't seen in 10 or 15 years, because during the outbreak people stopped getting treatment. And so there have been a lot of setbacks socially and from a healthcare standpoint. For a long time, I felt like God called me to be a missionary. And that's what led us to Liberia, was our pursuit of faithfulness to God's calling on our lives. And in the last 2 years, we found ourselves in very different circumstances. And we're learning, like Paul says, to be content in all things. And we're trying to learn to be present where we are and to live out God's calling regardless of our circumstances. I would like to get back to the kind of work we were doing before, but right now we're just trying to be present where we are. We expected to be in Liberia for 2 years, and that 2 years has come and gone, and we're in Fort Worth, where we never expected to be. I mean, we love Fort Worth. Southside Church of Christ became our home during our time of residency there, and that's what drew us back to Fort Worth when we were back in America. But we are in circumstances we never really wanted to be in, we never expected to be in, and so we're trying to learn to be faithful in those circumstances. It's, you know, I spend time traveling and speaking now and doing interviews, and that was never a part of our lives before. My children know that Daddy has to go talk and tell people about how God saved his life, and I'm thankful for that, but it is different than what we probably envisioned ourselves doing 5 years ago. In December of 2015, we made another transition, and I went back to work in full-time clinical medicine. So I returned to John Peter Smith Hospital, where I did my residency training, and I'm seeing patients there. I'm also training residents in general family medicine and in maternal child health and advanced obstetrics. I think when we pray for people, we can't be apathetic towards them. And so to intentionally pray for the people of West Africa who are recovering from Ebola, people who are Ebola survivors, people who have lost family members, it's going to keep them on your mind, and it's going to make you care about them more than you would if you just put them out of your mind. So I think praying for people is incredibly important, and God moves when we pray. I think also you can support organizations who are working in West Africa. Samaritan's Purse is still doing a lot of work in the recovery and rebuilding of Liberia. There are other organizations like Partners in Health that are stepping into new roles in healthcare in places like Liberia to help rebuild that healthcare infrastructure. But I think a very real thing that people can do, we don't often see that it connects to helping the situation in West Africa right now, but I think if we pay attention to the prejudices and the stigmas that we hold against people in our own communities, and if we start asking God to help us overcome those stigmas and those prejudices, it's going to change our community. And all of our communities are connected. And so as our community changes, the communities around us will change. And I think, just like we saw the interconnectedness of our world when there was an outbreak of an illness in West Africa that greatly impacted America, I think the breakdown of stigma and prejudice and racism in our country and in our communities can impact even places across the ocean. If I just had a minute to speak to anyone, it's the same message that I tried to preach as soon as I got out of the hospital, and that is that we have to choose compassion over fear. There are so many things in our society, in our lives, that try to motivate us with fear, that try to there's so much fear and anxiety in our lives, and we have to choose to set aside that fear and have compassion on people in need, to have compassion on people, period. And I think when we see the image of God in the people around us, it changes the way we treat people. So I think my message would be the same as it was before. Choose compassion over fear.